trucks to get people to a safe place. I've seen fire watches, I've seen food distribution, things of that nature. When there's a gap in anything for any reason whatsoever, someone steps in at the appropriate time to fill in that gap, and it just works out. We just work together well.
Well, what happened up here was the pipes started busting. The pipes burst and then the water started pouring out, and what I saw this week is how everybody chipped in from all different departments, helping us out up here to transport all these people to safety. Oh, it was a good feeling that everybody came together like that. JPS is a good place to work, and everybody pulled together, and it was good to see that. It was wonderful to see that.
I have seen the incredible spirit of this team this week. The ability to facilitate pop-up vaccine clinics, and we had the privilege of taking care of over 950 patients on Tuesday with vaccines. It is absolutely incredible. From the very top of our organization with Mr. Early out greeting patients in line, to our executives in the laundry, and the continuous offer of support, the ability to flex and move has been absolutely awe-inspiring. This team is phenomenal. The culture here is incredible. We definitely are the beacon of this community.
Yeah, that works.
Okay, perfect.
What's really interesting though is like when we were on the regular presentation, it was really grainy. So I don't know why it's today. So William, when you bring back, can you share that screen again? And there's actually a second setting. Let me verify what it is. Oh yeah, no, that's it. When you optimize for motion and video, make sure that it is already checked. Share your computer audio.
Yeah.
Whatever reason, it's really grainy on the PowerPoint, but it'll be okay.
That's better. That's good right there.
No, go back. Go back and go to that spreadsheet. Yeah, right there.
That's perfect.
Is it?
The rest, yeah, that looks great through my WebEx, but the buttons look terrible.
Yeah, so good enough. Good enough. Yep, it's great.
It's readable. Yeah. And we don't even know if those will be shown. So, so the video is the more important one because that'll for sure be shown. Eric, you did, and I just looked right past that there was a video there. Yeah, because I remember where you sent it, and I was looking in the wrong place. That's all on me.
All right, guys, I'm going to mute. I've got an 11:30, and we'll be back in just a little bit. Okay.
It's fine.
Thanks, guys.
Derek, you want to go ahead and bring the YouTube feed up? Oh, okay. Cool. Find it.
Test 1 2 3. Test 3 2 1.
Got it.
I'd like to call the Board of Managers meeting to order on 1300 hours or 1 p.m. Thursday, March 11th, 2021. And Leanne, if you'd give us the opening prayer and then the pledge. Thank you.
Hey. Hi, everyone. Good to be with you. Let us pray. Loving God, as we gather together today, we're aware that 1 year ago, all our lives began to change with the emerging realization of the pandemic that was upon us. And so we ask, as we look back, let us be mindful of all that's happened this past year, all the losses to be grieved, and all the amazing stories of JPS teamwork, resourcefulness, and success that is to be celebrated. As we look forward, let us be focused on the challenges, the opportunities, and solutions that will bring healing and hope to all the communities we serve. We thank you so much for the privilege of coming together to do this crucially important work that's before us. Grant us all we need to do so with courage, wisdom, and strength. In your holy name we pray. Amen.
Amen. If you all could join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. All right. Are there any citizens signed up to address the board?
There are no citizens, sir.
Okay, the next I have is number 4, the approval of minutes. Board of Managers meeting of February 11th, 2021. I entertain a motion.
So moved. Second.
Is there any debate? All in favor, please say aye.
Aye.
Those opposed say no. Motion passes. Next, number 5 is the board chair report. It's essentially the same as it's been for the last year, which is thank you for all the things that everybody does. I can no way single out anybody in particular. CEO, Mr. Early there? I don't see him.
He's there.
Where is he?
There you go. Thanks, Dr. Weber. I appreciate it very much. A couple things I wanted to go over with you guys that we've been dealing with here. We had a series of town hall meetings, and we're going to continue those, and we're doing them in the world in which we live in. So what we did is we had acclaim town hall meetings, and we had a meeting at 7 o'clock in the morning virtually. We had a meeting at noon virtually, and we had a meeting at 5 o'clock. And we had over 300 doctors sign up for those town hall meetings. And we talked about the direction. We talked about the third-party consulting group coming in that we will continue to give you board members. They just started working. Kieran's doing some, Dr. Duncan's doing some great work with them, bringing them in and helping us try to look at some of the issues that you all raised. Dorothy and DT and Chuck raised some really strong, and Roger, all y'all raised some issues that we think will be addressed really well. The town hall meetings went actually exceptionally well. The morale of our doctors, I think, is in a positive light. I think they're willing to figure out how we make a claim the best it can be, how we figure out the financing side of it, how we figure out the workload, the contracts, and in a world of COVID where your population bases change. So those town hall meetings went well. We're now going to take that model of town hall meetings at a smaller level and virtual. We're now going to do those town hall meetings for all the members of the JPS team. And the way we're going to do that is we're going to break it down by divisions and departments. So for example, we're going to meet with the employees of the emergency room and talk with techs and staff and nurses and get an idea of what's happening in the ED. We're going to do it with urgent care. We're going to do it with the Northeast Clinic. We're going to deal with our Arlington clinics. Everything is going to be broken down, and we'll have a series of town hall meetings to get ideas, suggestions, and how we move forward. To that extent, moving forward, the executive team has begun to do rounding. We are back on the floors talking to members. writing thank you notes to people that are doing a good job, getting suggestions on how to make things better. And that's a great communications tool. So we're in our efforts to do that. I think that's going very, very well. So we'll continue in that regard. Doctors Week is coming up. We'll have a variety of celebrations for our doctors to thank them, particularly in this really challenging world that we've had for the past year, as Leanne mentioned in her prayer. It's not like we're celebrating any anniversaries, but it has been a year since we've been coping with COVID. So we'll have some things planned for Doctors Week. We'll keep you all up to speed with that. JPS was recognized as a level 4 facility for maternal and neonatal care. That's a pretty powerful recognition. That level 4 status allows us to handle everything from routine births to the most complex births. That's the highest level of care that you can be awarded. We had a team come in. They looked at us critically. They made a lot of suggestions that we could do to be better. Our team did some amazing work at reaching that plateau that they gave us. So we have been approved at this point for a level 4. And that's good for our community. There are 2 level 4 facilities in Tarrant County. Baylor is one and JPS is one. So that's one more recognition to you as board members of what you all have put together and what you put in place for JPS's ability to better serve the community. Very proud of that recognition and distinction. The great 100 nurses is an honor for nurses. This year, JPS had 30 nominations. Of those 30 nominations, 5. And I believe, and Wanda could probably correct me on this, but I think 5 is the most we've ever had recognized as outstanding top 100 nurses. And if you think about all the healthcare organizations in Dallas-Fort Worth, they're huge. To have 5 of them in that 100 list is pretty substantial. So that was really good. We were really, really proud of that, and happy for where we are with our nurses getting recognized. You'll get more information about that. You'll see some posters that will go up outside the building, and we'll have some recognition for those 5 outstanding nurses in the top 100. Let's talk just a second about March 19th. One more time, give you guys an update. I know that Lauren is giving you guys a call, sort of talking things through with you, sort of looking at expectations. And so the information that we're sending out to you is information that we hope, obviously, that y'all will read through, give us an ability to discuss it at the meeting. It really is a broad view of what we're trying to do. We want to stay, as we cautioned the executives, we wanted to stay at a certain level by which we were talking about the overall strategic plan. And so after the interviews that you all have given, after the interviews that the staff has given at all different levels and community input, we now have a document to present to you all. And that document, we hope, will be reviewed, and we will look at making edits, amendments, changes to it in a positive way. And we're really looking forward to March 19th. I want to thank Dr. Weber for, one, allowing us to have that. That'll be the first time really in a year we've come back together in a meeting. I know some of you are not going to be able to make it. You will do it virtually. We appreciate that. It's a tougher time because some of you do have some spring break obligations, and there may be even one member of the board who may be vacationing in Hawaii. I don't know, that's just anecdotally, that may possibly be the case. That one board member who might be going to Hawaii didn't invite any of the rest of us to go to Hawaii. Probably a good idea to have a retreat. Yeah. So we're not having the retreat in Hawaii.
Listen, I'm lucky Shannon invited me to go to Hawaii. But
well, I wasn't gonna mention any names,
I'm
but
gonna wake up at 3 o'clock in the morning to join.
There's only one board member married to Shannon. So
you know what's odd though? What's really odd is she invited me too. Huh?
Hey,
You can always tell Robert's guilty dog squeals.
yeah.
He couldn't get
Steve Montgomery gets the bill, so this is going to be a blast.
Yeah. Well, if Steve Montgomery is going, you're going to stay at a different place than you thought you were staying at. I can assure you. So, one of the things that I do want to take a moment of a point of personal privilege is to let you all know, and I've mentioned this before, but I can't mention it enough, of what kind of place you all help lead. And you as board members, all 11 of you have such input into this organization. But the culture of JPS is, in my opinion, unfounded. When you have COVID challenges, and we are down to having about 45 hospitalized COVID patients.
Awesome.
That is a far cry from where we were when we were at 225. It's not where we want to be. Obviously, we want to be at 0, but those numbers have allowed our team to at least be able to get a little bit of a breath in the challenges of COVID. But when you look at COVID, and you look at the stress of COVID, and you look at the need for bringing travelers in, and you look at pay disparities and all the challenges that COVID brings, not to even mention the fact of losing lives and the challenges that we have there. And then you add on to that a weather situation that I've certainly, in all my years of living in Texas, have never seen. And you add that and compile all that together, I don't think many teams can put up with that the way this team did. And I wanted y'all to know how humbling it is for me to work with people like that. I have the ability to see them every day. You all have the ability to see them on various occasions, but I get to be here every day and see it. So what our communications team did is our communications team put together a quick video. It's really a video for us. It's a video for you all as board members to see. I talked to Dr. Weber about it, and Dr. Weber and I both thought it would be a really good idea if you all just took a minute to take a breath and go, wow, that's where I'm leading that organization. So we put this together for us to have pride, but as importantly, we put it together, our communications team put it together so you as board members can take pride when you wake up and have to come to 3 meetings in a day, or you don't get, the cookies that you thought you were going to get, or to some people who are still thinking you're paid to be a board member. Hopefully that's set in now that you're really not ever being paid to be a board member. So all of that culminates in what actually is great people doing great things, and you all have done a lot to lead that. So if we could run the video, I wanted y'all to hear the words and see the pictures of some of the most incredible people I could ever work with.
It just seems like everyone's always prepared. I mean, from administration down, we're ready to go. Teamwork makes the dream work, they say, right?
Always ready, means, for us as leadership is constantly assessing our areas, all of our resources, our staffing, our facilities, and being prepared. It's also the heart of who we are, is that we know that we're here to serve the people in our community, and that means whatever they need, wherever they need it, we are there.
Complete shutdown of mass transit. Folks that have been seen medically and are in discharge, but they have nowhere to go. We have no way to get them there. A process was brought up to get people to a safe place. I've seen fire watches, I've seen food distribution, things of that nature. When there's a gap in anything for any reason whatsoever, someone steps in at the appropriate time to fill in that gap, and it just works out. We just work together well.
Well, what happened up here was the pipe started busting. The pipes burst and the water started pouring out, and what I saw this week is how everybody chipped in from all different departments, helping us out up here to transport all these people to safety. Oh, it was a good feeling that everybody came together like that. JPS is a good place to work, and everybody pulled together, and it was good to see that. It was wonderful to see that.
I have seen the incredible spirit of this team this week. The ability to facilitate pop-up vaccine clinics, and we had the privilege of taking care of over 950 patients on Tuesday with vaccines. It is absolutely incredible. From the very top of our organization with Mr. Early out greeting patients in line, to our executives in the laundry, and the continuous offer of support. The ability to flex and move has been absolutely awe-inspiring. This team is phenomenal. The culture here is incredible. We definitely are the beacon of this community.
I wanted you all to see that, and we'll provide that video to all y'all. That's not a it's not a video that is contrived. That's a video that our own communications team did. We didn't spend a huge amount of money for public relations to do that. The other thing is the folks in the communications team that put that together, the only way they could put that together was to come through the ice and the snow and be here. The reason they got pictures of people in hallways with water going everywhere is they were standing in the same water and they were doing the same things that everybody else did. So you as board members need to know that when you vote on budgets and you vote on the issues that you're dealing with, and we as a team, Karen and I try to put things together that we keep that culture and we keep that mentality. Some people can say, you know what, okay, Early, you're giving honey away to people, or you're making pies for people, or you got 3 basic rules of, own it and seek joy and not being a jerk. Those things come into play when you're at the most levels of being down. And at the same time, they're trying to lay paper towels and blankets over watered floors, because in that video, it's hard to see, but in the one picture, water is literally coming through all the ceiling tile. And that's because you all as a board have allowed us to create that culture that we have at JPS. And there were a lot of organizations that faltered during that time period. JPS set up, 300 plus cots, and people spent 4 and 5 days living here. They didn't go home. And I couldn't work for a better organization, and I couldn't have a more supportive board. So I wanted y'all to see that.
Hey, Robert.
Yes, sir.
This is Charlie. I just want to say thank you to you and Chuck and for letting us see that. I think we've all said 1,000 times, JPS is not the buildings. It's the heart and soul of what's inside those buildings. And whether you're staff or whether you're the board, I think we all appreciate everything you're doing. Chuck, I commend you for letting us see that. We all need that reinforcement. Last time I was in the hospital was to get my shot. Staff was great. I think I called and told you, Robert, they couldn't have been better. But I think we all need that because we miss seeing those people as much. We used to come into the building a lot. You got to see people at the front desk and see how, and again, I was saying to you, Robert, great job, you and Karen, what you're doing. I'm not going to try to say something funny because I think it's really a sincere video of what we are at JPS. I did notice the one person you were greeting in the hall did have a t-shirt on, so Mr. Montgomery could probably pick up on that. But anyway, thanks, Robert, for you and everybody, and Chuck, thanks for running that.
You bet.
Anybody got any comments? Go ahead.
Chairman Weber, that's all I have for my report. If y'all have any questions or any comments on the video or anything else, but that truly is a snippet of what took place here during what was already a difficult time. And again, you're not going to find better people ever.
And Robert, you didn't even mention the car wreck right before that created its own in addition to the pandemic and the job you and the staff do every day. And then they had obviously the pile up, and then came the freeze. I mean, it's been just an ongoing. So all that together, I think the video says it all.
Thank you, Charlie.
No, what I would say to everybody is well done.
Yeah.
Anybody have any questions for Robert about anything? Okay, seeing none, then report from medical executive staff. Cheryl Hurd.
Hi, Dr. Weber. Dr. Weber, you skipped number 7, department update.
Well.
Yeah. And Chuck, if you want me to, I can premiere. Let's see.
Well, go right ahead, but on my agenda, that goes to number 7, and that's report from the medical executive staff.
Yeah.
For the cystoscopy privileges, is there something I'm missing?
Yeah, Suzanne, what I think we have is an agenda here. I mean, we have, the agenda I'm looking at does not have that item on here. The next item, number 7 on these agendas, is Dr. Hurd.
The agenda that was posted has Jill Farrell, and my apologies, the wrong agenda was printed out for everybody's book.
Well, does that mean that we can go on with it, Daphne? Or
yes.
Or
yes, the agenda that was posted has Jill Farrell on there.
Okay.
Follow the posted agenda. I don't have that agenda either.
Again, my apologies. The agenda that was printed and put on everybody's book was the wrong agenda. It was the correct agenda is posted with Jill Farrell as number 7. The agenda is posted at the county public notice website and our website as well. So we could discuss it.
Well, Daphne, I'll need your guidance on this. Should we go ahead with it or not?
You can follow the posted agenda.
Okay, then.
Dr. Weber, I can intro that for you. Jill Farrell, we have brought in. Jill was part of our organization. I introduced her to you all last time. And from the comments that many of y'all have had over the last couple of years, is we at JPS don't want population health and health disparities to be a buzzword. And if you look at the emphasis that JPS needs to place on case management and getting to our patients and helping them, our patients are hampered by a lack of transportation. Our community is lacking, and many of our patients live in food deserts. And even though we try to help them with issues like comorbidities of diabetes, if you live in a community where you can't get a food source, you're going to have a hard time offsetting the challenges of diabetes. If you are constricted in some form or fashion because of what society has either not given you or not allowed you to participate in, our patients are going to lose. So Jill is gifted and talented. And Dr. Duncan and I spent some time trying to figure out the best way to handle population health and case management. And it didn't take us but a second to see the attributes of Jill Farrell. She is a great talent. So we moved Jill up to a vice president level and dealing strictly with those issues. So I wanted Jill to spend just a couple minutes with you going over some of the responsibilities that she has, because I think Steve and Amanda and Dorothy and DT that have played a critical role in this, and Pastor Emerson, who we've tried to figure out how best to do this. I think we have a real leader to help us direct it now, not just talk about it, but we really have somebody who can initiate some of the ideas that you all and we as staff have. So Jill, you are on a high pedestal for a reason. You're good. So why don't you tell the board exactly some of the things you're going to do?
Yeah, I appreciate the introduction, Mr. Early, and you're too kind. As he mentioned, I've been at JPS now for almost 4 years. I'm a nurse by background. I've been leading the nursing operations in community health during that time period, as well as having operational oversight in women's, oncology, specialty care services, as well as leading our mammography program. You know, really spent a lot of time working in that division on standardization of nursing care practice, staffing models, and other services that we provided in community health, and really looking forward to this new position. I'm honored, excited to be the Vice President of Clinical Integration here at JPS. I feel like the timing couldn't be better as we're starting to move towards having more data to support some of our decisions As we also have a strategic plan that's going forward for our network is really exciting, and I think we're well positioned really to improve our patient outcomes. In this role, integration is kind of the buzzword. Really what I'm going to be doing is working with all of our internal, external stakeholders to really pull together not only work that we're already doing in many locations, sometimes a duplication of work perhaps, or really enhancing some of the work that we already do, as well as leveraging new programs, really based on that continuum of care across inpatient, outpatient in our community, based on evidence-based clinical care and best practices, with ultimately the goal to improve our patient outcomes. Not only improving our patient outcomes, but also controlling our cost, making sure patients are getting the right care in the right place at the right time, but also addressing disparities, cultural differences with our communities, so we make sure that the care that we're providing is customized not only to that population, but that individual patient as well. This, of course, means a lot of collaboration, as I mentioned, inpatient, outpatient, behavioral health, nursing, physicians, IT, analytics, finance, really across our entire network, and how we really manage to pull all that together. Really, it's every entity within the network that has to be working together in order to achieve that success, as well as community partnerships. There's opportunity. There are many great programs and great work that's happening out in our community, and really how can we leverage our relationships for the betterment of our patients as well. As I mentioned, we already do have programs and initiatives across the network already doing some of this work. It's what we do. I mean, as clinicians, we want to take good care of our patients. So we already constantly do this. But again, really looking for synergy and enhancement, as well as development of new programs across the patient care journey. As Mr. Early mentioned, I do have operational oversight of case management. But really, more than just inpatient and outpatient case management, there are opportunities for transitions of care as we move patients out of our system into the next level of care. There's many ideas of programs around disease-specific management programs. For example, diabetes, we know, is a disease that affects a lot of our patients, and there are opportunities to better manage and take care of that population. There's been conversations about community health workers and other community initiatives, really to, again, look at our patient population across the different areas in Tarrant County. So I'm really excited. I'm looking forward to this opportunity, just getting started and building my team. I know it's again, a great time for us to do this work. And I really do look forward to the future and being able to share with you and come to these meetings to provide you with our successes and our progress as we go down this path to take care of our patients. So thank you for the opportunity, and it's really a privilege to help take care of our patients. So thank you.
Jill? As Dr. Weber, as Jill continues to put programs into place, we had about a year and a half ago now sort of put a little group together to help us with population health. And Amanda and Steve and Ralph and Dorothy, some of you all serving on that committee, will continue all to sort of give you updates as Jill begins to formalize some plans on how we're doing things and what we're doing. So you'll see her periodically to give you all, as board members, updates on that as I continue to work with y'all, not only individually, but in its total. So thank you all.
Comments for Jill? Jill, I'd say you have a very difficult job ahead of you. That addressing all the social aspects of things that go into population health is very difficult. So I wish you well, and I'll bet you succeed.
I think I will, and I appreciate that. It is a task, but it's a task that we all must take, and I do think we'll have progress. So I appreciate that.
All righty. Anybody else with comments, questions for Jill?
I'm just curious, what from the OPLOT perspective, where do you fall into? Which department is that, Jill?
I'm reporting to Dr. Duncan. My department is clinical integration. And so again, have case management as well as this population health management work as well.
Thank you.
You're welcome.
Okay. Anybody else? Jill, thank you. The next one I have is now Roman numeral whatever.
8.
8, report from the Medical Executive Staff Committee, Cheryl Hurd.
Thank you. Sorry about that. I too didn't have the other agenda, so I apologize if I spoke over someone, but thank you for the opportunity, Dr. Chair. And before I do bring forward the couple of privilege forms, I just want to once again give y'all a bit of an executive summary of what MEC is doing. We're moving forward with our bylaws revisions. Our bylaws consultant has been virtually introduced to Ms. Walker, and they are in communication so that make sure our bylaws don't have anything contradictory to the board's bylaws. And also, we are very much looking forward to Doctors Week that Mr. Early mentioned earlier. It is going to be the week of the 26th. Doctor's Day itself is the 30th. And just to add a few things, every morning there'll be breakfast. There will be raffles for different packages. The theme is a bit of like an outdoors camping kind of theme. So there'll also be really nice gifts given to the physicians as well as the resident physicians. So there's coordination with academic affairs. And we are still planning on having our recognition of our advanced practice providers in the fall. Their days usually around October, November. So we're going to continue with those celebrations to ensure the culture remains the same and people are excited to be here. And anyway, just wanted to take an opportunity. Thanks for the indulgence of that. I do, for a change, have 2 forms to present. It's in your packet. The first one is just the addition of cystoscopy privileges. Special non-core for urology advanced practice professionals. And just brief summary is just that there are some non-diagnostic privileges that our urologists would like their physician assistants and nurse practitioners to be able to perform here at JPS. And it's just a 1-page form that talks about what the level of supervision is required and the criteria for meeting this special non-core privileges that would then be approved through the credentialing committee and MEC. This form itself was actually put forth by their department and vetted and approved through the credentialing process and then also approved by the MEC. Do we have to take them separately or can I talk about the next one and we take them as a group?
Daphne, what do you think? Take them separately?
It doesn't matter. Does anybody have any questions about the first item?
Well, I guess not. Then go ahead with the second one, Cheryl.
Okay, great. The second form is actually addition of robotic assisted procedures to specialty forms. And this is for physicians. In particular, be added as clinical privilege forms to fulfill the criteria for training experience in the following categories: cardiovascular thoracic surgery, general surgery, obstetrics and gynecology, otolaryngology, oral maxillofacial surgery, and urology. And the form itself is listed there. The 2 has been actually vetted by all of the departments as well as through our credentialing committee and the MEC, and we're just moving both forward for approval from the board. So I'm requesting an action item, or excuse me, approval item for these 2 forms to be approved, and therefore we can start utilizing them.
May we have a motion and a second to
I'll move approval on both.
I'll second.
Chuck.
Okay, any debate on any of these? I don't hear any.
I didn't get who's second. I got Roger, but who seconded? Because 2 of them spoke up.
Suzanne, this is Charlie.
Okay, thank you.
Okay, then there's, with no debate, there's 2 that we're going to approve. That's the addition of cystoscopy privileges and the addition of the robotic assisted procedures for the special form.
Right.
Any debate on it any further? All in favor, please say aye.
Aye.
Those opposed say no. Motion carries, Cheryl. Thank you.
Thank you. That concludes my report.
We'll see you later. Committee reports in action. The first is the Finance Committee. Steve Montgomery.
Thank you, Mr. Chairman. Sorry, I was booking my flight to Hawaii with Team Fisher. So we had a great We had a great committee meeting on the 25th. I think it was attended by most everybody on this call. Ms. Clark provided our January numbers, and she's available if y'all have any questions on that. And we also submitted 8 items for the board's consent, and we've asked their favorable consideration. I believe they're under the consent agenda. So they're there for your consideration. That's my report, Mr. Chairman.
All righty. Governance Committee, Roger Fisher.
Hopefully the state of Hawaii turns down Steve Montgomery's request to visit. Steve, it would be a pleasure to travel with you, sir, anytime, anywhere.
We would have fun.
Governance met on the 25th as well. We have 4 policies to put forth to the full board. They were all passed unanimously at that meeting. We tabled the internal audit charter item to a future meeting to work with Dorothy and HR committee. I do want to share with the board that I had a very positive call with Dr. Haynes last week in regards to the policy LD 1000. I was really happy to hear that from the medical staff side that they don't want the orientation of board managers, senior management, leaders of the organized medical staff to simply check a box when it comes to that orientation. Dr. Haynes is sincere in wanting to have a robust program to really, share the culture of JPS, everything that we do and what we stand for, understand the politics of what goes on in a publicly funded hospital. And I was really happy with that phone call. So we're going to work on, Dr. Haynes and I are going to work on that, as well as figure out how we can, I don't want to say put teeth into the policy, but to make sure that it's not just a checkbox. And yeah, we talked about orientation, check it off. So I'm excited about that, and excited that the medical staff is eager and wants it to be something. So that was good news. Other than that, no report.
Okay, comments for Roger? The next one I have is the Tarrant County Hospital District Public Facilities Corporation meeting. What's that?
Dr. Weber, this is Robert Browder. Would you like for me to do this report?
Absolutely. I was just real proud of myself that I could say all those names that go there.
You're doing better than I can, I tell you. The Tarrant County Hospital District Public Facilities Corporation held an organizational meeting on February the 25th. The corporation elected officers, adopted bylaws, and approved a non-binding resolution. NRP has now submitted its application to the Texas Department of Housing and Community Affairs, and we anticipate that for the next 2 to 3 months, we will be in a holding pattern as TDHCA reviews the application and we find out how it scored. Unless there's anything that we need to address after the review by TDHCA, I anticipate that any further board action won't be necessary until we get close to the end of the year.
Okay, comments, questions for Robert? I think one of the things, Robert, is one of the things is there was some question at one point whether or not all 11 board members would have to sign the document, and that was no, they did not.
That's correct, and that's the one thing that Jim Plummer talked about at the meeting, and that is there is a slight possibility that TDHCA may come back and say we need all board members to sign on that. We think that is very remote, though. So the way it's submitted is we have the 3 authorized signers, you, Dr. Weber, Robert Early, and myself have signed that document, and that's now part of the application with TDHCA.
I might comment that in reading the document, there were 9 areas that I had questions about, and I spoke to Daphne. And what we also have is a letter that indemnifies those of us that signed the application. And I'll let it go at that. You want to say anything, Daphne, about that?
No, sir, I think you covered it. That's just part of the submission, and I did walk you through that for purposes of the certification.
All righty.
Daphne, this is DT. Do we need a separate D&O insurance for that?
Do we need what, DT?
A separate D&O insurance for that new entity?
No, you don't need separate insurance. That's a subsidiary of JPS, and we have that should be covered under the current policy.
Thank you.
Any further comments for Robert, et cetera? Okay. Next, I have Planning Committee. I think Trent signed in. I thought I saw his.
He may have signed in. And see.
Hi, I'm here. Can y'all hear me?
There he is.
Good.
There. Hey guys. Sorry, I'm going to spare you the video because I'm. Went over all of the progress on the emergency repairs that you're all quite familiar with. I was happy to get Adam to give us some detail regarding the team's response. So kudos for everyone, especially the work that trying to keep those repairs in process during all that was a challenge, but they did a great job. Adam gave us a brief report on the Meadows item, which is on the agenda today. We talked through that. And Angie gave us an update on our capital projects plan. So unless there's any questions, I'll road and get off and listen.
Anybody got any comments, questions for Trent?
Yeah.
Well, have a safe journey, man. The last one is the quality.
Thank you very much, guys.
Thanks, Trent.
You bet. And we met on the 4th of March, Thursday. I heard somebody. Oh, well. There was a presentation by Rick Miller about the sort of preoperative evaluation and optimization folks that appear to have made quite an impact on the folks that require surgery. And from a quality aspect, we slipped a little on the pressure ulcer side. So they're ramping up their committee to look at all that stuff. And other than that, I'd say that the quality stuff looked pretty good concerning everything that went down with COVID and is still going on with COVID. And that's it for me. Anybody got any questions, comments? All right, hearing none. Next, I have ratification of emergent matters approved by the officers of the Board of Managers, and that's the approval of the contract with McWilliams Collective. Sharon, you taking that one?
I am, thank you. As you read through this, I do want to point out that even in a year into the pandemic, we are still watching our PPE very carefully. We had the opportunity to participate in kind of a huge group purchase and commitment for gloves. This ratification, we did get board chair approval for this back in February, but it is for $353,000. It allows us to buy 40 pallets of gloves, and right now the allocation that we are receiving is a little bit lower than our actual utilization. So this will carry us. It's a unique opportunity for a large bulk purchase of gloves at what we consider slightly below market price currently. So this is both an exception to bid and a ratification of this purchase order that I'm asking for today.
A question, Sharon. Can we buy outside of the current GPO that we have with Vizient?
I'm sorry. I think your question was, can we buy outside the GPO who is currently Vizient? The answer is yes. We are allocated kind of a historical amount, not guaranteed, but an allocation at a really good price. However, our utilization is higher. So actually our GPO is the one who presented this offer to us, although it is outside the GPO pricing.
Okay, thank you.
You bet.
Any comments, thoughts, debate for Sharon? Because if not, I'd entertain a motion to approve and a second.
I move to.
I heard Dorothy. I didn't hear.
I was moving approval.
Okay. Is there a second?
Second.
Well, second.
Is that Steve?
Okay, Sam.
Sam.
Okay. Any debate at all? All in favor, please say
aye.
Aye. The motion passes. The next thing I have is the consent agenda. It has items A through T. And if nobody wants to have any further discussion about these, I'd entertain a motion and a second for approval.
This is Zim. Move to approve.
Chuck, I'd second.
Any debate from anybody? All in favor, please say aye.
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 Those opposed say no. Motion passes for the consent agenda. Next thing I have is to report of legal counsel on the contracts negotiated on behalf of the district that are under $500,000 for the previous month.
Thank you, Mr. Chairman. We had 43 contracts in the month of February that were under 500,000. And that's all I have to report.
Okay, now those were also in your booklet to review. And the next thing I have is to convene in executive session. Do you folks want to keep right on going or take a small break?
Keep going.
Keep going for one. Looks like keep going. All right, then I have the
David ready.
Yeah, not quite yet. We're changing you right now. Thanks, Daphne. So Dr. Weber, give me just a moment so that we can get you in closed session, okay?
What do you mean you're changing me?
Dr. Weber, I'm so sorry. We know that that's never possible. I am so sorry to even insinuate that.
No, I thought it was a compliment. My goodness. I'd like to reconvene in open session for deliberation and/or action deemed necessary. And the only thing would be privileges. Cheryl?
Thank you, Dr. Chair. I'll make a motion to approve the credentialing privileges as presented in executive session.
I'll second that motion.
All righty, any debate? All in favor, please say aye.
Aye.
Those opposed say no. Motion passes. Thank you. That is all I have as chair. And having said that, it's time to go.
Thanks, Chuck.
All right. Thanks, everybody.
Thanks, everyone.
Thank you. Thank you all.
Thanks.